What are eating disorders? Understanding the different types. Eating disorders are a group of serious mental health conditions characterized by abnormal eating habits that negatively impact physical health, emotions, and relationships. These disorders often involve an unhealthy focus on food, weight, and body image, and can lead to severe medical and psychological complications. In this article, we will explore what eating disorders are, the different types of eating disorders, and the impact they have on individuals' physical and mental health. 1. Types of eating disorders. There are several types of eating disorders, each with its own distinct characteristics and diagnostic criteria. The most common eating disorders include anorexia nervosa. Anorexia is characterized by an intense fear of gaining weight and a distorted body image that leads to self-imposed starvation. Individuals with anorexia may restrict their food intake, exercise excessively, and have a preoccupation with weight loss. Bulimia nervosa. Bulimia involves binge eating, where individuals consume large amounts of food in a short period, followed by purging behaviors, such as vomiting or excessive exercise, to prevent weight gain. This cycle can be driven by feelings of shame and guilt. Binge eating disorder, BED. Binge eating disorder is similar to bulimia but without the purging behaviors. Individuals with BED often experience episodes of eating large amounts of food while feeling a lack of control, followed by distress or guilt. Pica. Pica is a condition where individuals eat non-food substances, such as dirt, clay, or chalk. This can be a sign of nutritional deficiencies or a psychological disorder. Orthorexia. Orthorexia is characterized by an obsession with eating foods that are considered healthy, to the point where individuals may exclude entire food groups or foods they consider unhealthy, leading to nutritional imbalances. 2. The psychological factors behind eating disorders. Eating disorders are often linked to psychological factors such as body image dissatisfaction, low self-esteem, and a desire for control. The disorder is not simply about food or weight, it reflects deeper emotional and psychological struggles. Body image issues. Many individuals with eating disorders have a distorted perception of their body size or shape. Despite being underweight or overweight, they may feel dissatisfied with their appearance and engage in extreme measures to control their weight. Emotional regulation. People with eating disorders often struggle with managing their emotions. Eating may serve as a coping mechanism for dealing with stress, anxiety, depression, or trauma. Perfectionism. A desire for perfectionism and control is common in individuals with eating disorders. The pursuit of an ideal body image or strict dietary rules may stem from an overwhelming need to feel in control or to achieve a sense of accomplishment. 3. The physical impact of eating disorders. Eating disorders can have serious consequences on physical health. The extreme behaviors associated with these disorders can lead to a range of medical complications that require immediate attention. Nutritional deficiencies. Self-imposed starvation or purging behaviors can lead to malnutrition and deficiencies in essential vitamins and minerals, which can affect heart health, bone density, and overall organ function. Digestive problems. Purging behaviors, such as vomiting or laxative abuse, can cause severe digestive issues, including dehydration, irregular bowel movements, and gastrointestinal damage. Cardiovascular issues. Individuals with anorexia nervosa may develop a dangerously low heart rate, irregular heartbeat, and low blood pressure, which can increase the risk of heart failure. 4. The mental health impact of eating disorders. In addition to the physical consequences, eating disorders have a profound impact on mental health. Individuals with eating disorders often experience anxiety, depression, and obsessive thoughts about food, weight, and appearance. Anxiety and depression. Many individuals with eating disorders struggle with anxiety, depression, and a sense of worthlessness. These emotions can fuel the behaviors associated with the eating disorder, creating a cycle of emotional and physical distress. Obsessive thoughts. People with eating disorders often experience obsessive thoughts about food, weight, and body image. These thoughts can become all-consuming and interfere with daily life. 5. Treatment for eating disorders. The treatment of eating disorders typically involves a combination of psychotherapy, nutritional counseling, and medical intervention. Psychotherapy, particularly cognitive behavioral therapy, CBT, is effective in treating the underlying psychological issues related to eating disorders. CBT helps individuals identify and change unhealthy thought patterns related to food and body image. Nutritional counseling, working with a registered dietitian, can help individuals restore healthy eating habits and develop a more balanced approach to food. Medical intervention, in severe cases, medical treatment may be necessary to address the physical consequences of the eating disorder. Hospitalization may be required for individuals with extreme malnutrition or life-threatening complications. Key insight: eating disorders are serious conditions that affect both the physical and mental health of those who struggle with them. Early intervention, therapy, and medical support are essential for effective treatment and recovery.